Well, again, I'd like to welcome all of you who've joined us. We're excited to have you hear some different stories from people who've come to the lactation field from all kinds of places. And I'm just going to share my screen. I have a few slides to share. So you're here tonight to hear about lactation, which is officially defined as the healthcare professional that specializes in the clinical management of breastfeeding. So just as some of you noted in the poll, sometimes we're inspired by just those big eyes looking at us. And I found this quote to be telling. Your life's work begins when your great joy meets the world's great hunger. Or if you can't feed 100 people, then let's just feed one. Mother Teresa said that. So we're all here for various reasons. And we know already that there's 34,000 lactation consultants around the world, but there's 140 million babies born every year. So I think there's still a need for those of us. And in the US more specifically, there's 18,000 lactation consultants to match with 3.6 million births each year. So as you can see, there's an unmet need. And where do people go with the lactation certification? Some of the options could be working in the public health department. Many of our lactation consultants work in hospitals. Family birth centers are an obvious place, but many people also work in the NICU, working with special needs babies, as well as in an outpatient setting within the hospital. OBs and pediatric offices also employ lactation consultants to serve their families. And in Oregon, and probably where some of you all are from, we also have a thriving private practice community for people who are doing home visits or perhaps have their own offices. There's also the possibility of working for a community organization. You'll hear more about that tonight, but there are community organizations out there that support people having a better time with breastfeeding. WIC is one of the main supporters and providers of breastfeeding support and education for many of our people in the country. For those of you who don't know, that stands for Women and Infant and Children, and it's a nutrition and education program that operates in most counties in the US. And last but not least are the milk banks. We are lucky to have a very active, although young, relatively, milk bank here in Portland. But there are more and more of them around the country, and they employ lactation consultants as well. Can anyone think of something I did not mention, or a place that could be an employer that I didn't think of? Okay. There's also options along the way to becoming a lactation consultant. Many folks start potentially in a peer counselor capacity, where they, as a person who's breastfed, take on additional training and then work sort of peer-to-peer or mother-to-mother, providing breastfeeding support. The next level is often a lactation educator or a breastfeeding counselor. So with more education, and often they will teach classes at hospitals or maybe provide support, kind of basic skills support to breastfeeding families. And then what we're here to talk about tonight is the International Board Certified Lactation Consultant certificate. That is kind of the top that we have. So before you get on a pathway, you need to come to us with a little education. And For many people, that might be because they've already started a health career. And so the chemistry and biology and so forth that they've taken there will count. But for others, they will be taking those as health sciences credits prior to enrolling in our program. Then we offer the lactation education here at Portland State, and that's the class that Carrie and Dixie are teaching. And then after that, we have a choice of 3 pathways. And I know some of you have already mentioned those in the chat. Pathway 1 would be for those who already are working with breastfeeding families and therefore can be able to use the work that they already do to count towards the hours that they need to sit for the exam. So that will add up to 1,000 hours. And I don't know if, well, I'll have those of you who are out there talk about how long does it take on Pathway 1 to get 1,000 hours. Pathway 2 is the program that we offer here. And that's where you work with a clinical instructor and then are placed around the community in various precepted sites, and you're after 300 hours, which takes about 3/4. And then pathway 3 is when an individual student signs up and finds a mentor, and that person has already been in IBCLC for about 5 years, and they work together to sort of as apprentice to get the 500 hours. So those are kind of the 3 options that are out there. So why associate with our lactation program? Why study with us? Well, I'm going to start from the bottom. There are degree options if you decide to study at OHSU PSU. So you could be in school already. You could complete your bachelor's. Those are things that would be available to you at a university that would not necessarily be available at a continuing ed kind of situation. There's also scholarships. And then last but not least is the availability now of distance learning. So you could live in Missouri, for example, and still be able to complete a program with us. We are affiliated with many leading hospitals and organizations on the West Coast, and adding more as we speak. We have a knowledgeable, very accessible teaching personnel. And last but not least, our students do very well passing the exam. So I didn't mention, after you've gotten all those hours, then the next piece is applying to sit for the exam. And that is administered twice a year all around the world, 1 test. And it's kind of an interesting experience, rite of passage. So I do not want to spend too much time because I want to have our speakers tell their stories. So my format for this is I'm going to give each person about 10 minutes to tell the sort of their trajectory, how they got through the first few years, any challenges they encountered, and what are some words you would have told your younger self? Like if you could go back in time, what would you tell that person? Quickly, Linda Bryant-Daka is here. She is from the East Coast and worked through the WIC program to become a lactation program, and I'm sure she'll tell us more about that. And currently she works with the Black Parent Initiative, working with getting lactation support out to our families in the African American community. Thea Neal Schneider comes from a community health nursing background and added on lactation after. Marissa McKelvey, we know she's a nurse in the hospital and also came inspired by her children, sort of took a turn to begin her career as a lactation consultant. So was in another part of the hospital. And then Lara, who will join us shortly, also began with WIC and then did some time in private practice. So I want to hear about that. All right, so I'm going to stop sharing my screen, and I think I'll let Linda go first.
Thank you. Can you hear me?
Yes.
Okay. So my name is Linda Bryant-Daka, and I work for the Black Parent Initiative. So I'm a manager of a program called the Sacred Roots Doula and Mobile Lactation Services Program. And so that program has been in existence actively since 2017. Funding was started by an insurance company, Family Care, in 2016. They actively started the program running 2017. So I worked there as a full-time IBCLC, but we're talking about how did I actually get started to actually work and develop that program. So I got my start, actually, Michelle said in WIC, but actually my first lactation job was with a hospital. Oh. There was the first lactation research project that was with in Connecticut, Hartford Hospital, that's in Hartford, Connecticut, and the University of Connecticut, and then a Hispanic Health Council program. So I was a stay-at-home mom and I wanted to get back out into the workforce. And I actually saw an ad in the newspaper for a peer counseling program. And as I'm reading the article, it said, oh, okay, we will train you to, if you have been a breastfeeding mother for at least 6 months. And I had 10 children. So I said, whoa, okay, this works fine. You know, I was so elated. So I actually applied to the program, and it was a very interesting program because it was community and hospital based. I had 2 different IBCLCs, one at the hospital level who was a nurse, and the other was a community IBCLC. And so she had a background in, I believe it was public health. So we worked on the community level, and we actually went into the hospital, looked at the board every day who was inpatient, and we actually worked with those mothers. And when they went home and they had challenges, we actually went to their homes. So that was my first actual lactation job. And I will say that a lot of the things that they allowed us and taught us how to do would be considered out of scope for a peer counselor. So I actually had that first start there. So then when I moved from Connecticut, I moved back to New Jersey, where I'm originally from, and I was looking for a program similar to that. And I actually couldn't find anything. So I went into home visiting and parent education. So I figured if I was going to leave my children, I always wanted it not to be with a business, but more in line with, you know, a social service type program, helping other mothers. So keeping with that, I worked doing that for a while. And then I worked with one organization, and they had quite a few lactation consultants. And so I asked them, the program that I was working with as like a parent educator, I was asking the IBCLCs that were there, these nurses, so who is helping these moms that I'm working with? And it was a maternal and child health program. And they actually said, well, I guess nobody. And because they were doing other things. So I actually asked if the grant, it was a Healthy Mothers, Healthy Children's grant from federal level, but we were doing that grant. So I said, what about if we established within the program with the mothers who have delivered babies, if I can help them? And then they said, well, that's fine, you know, document the hours and what you're doing. And then we also established that WIC needed help. They didn't have anybody of color working there. So I became a peer counselor, split up the grant. I did 8 hours a week with WIC. So then that was my first encounter with WIC at that point. So then after I started working with that program, then it was a program for homeless women. Most of them were teenagers, and it was a house that they stayed in a residential program. So I provided that work there. And that was also in New Jersey. And then when I moved to Maryland, then I finally formally worked for WIC. And then I got the kind of help in terms of getting lactation specific education, because it is very expensive. So when I went to Maryland, the person that was my supervisor there, that was a director of the program, you had a couple zip codes that you work within and you covered that area. So when I talked about all the needs that I saw in Black communities, duration rates. So when I started at that WIC office, I think maybe 85% of the women there were African-American or African, and we had a 24% rate of initiation. So it was pretty terrible. So she allowed me to be creative and help expand the program until when I finally left the program 6.5 years later, we were at 74%. So that was, you know, just exciting to see as the program grew. And within that time, she invested in my lactation education, my first lactation specific education beyond that first hospital experience. So that was with Healthy Children's, and they paid for it. And then I took a course with Marie Bancuso. That was my second course, and it's very helpful. And so they're two different, to me, they were two different aspects of the same thing. But she goes into, to me, more of a research aspect and things like that, a little bit different than Healthy Children's. But Healthy Children's, though, I will say personally encouraged me to sit for the test. They said, you can pass the test. You just need to sit for the test. And so they told me that, so the first year I took it, I was late for the test. Yeah. And so, so I had to take it. So that was 2010. And then I took it again. So I actually took it in 2011 and passed the test. And that's where I actually, so I did get the help that I needed to circumvent that financial aspect from WIC. And then I could meet the hours easily because I was working 40 hours a week and doing nothing but lactation. So I had the hours, etc. And so that's where I actually got the start. And then when I came here, I started as a doula here. And so that was 5 years ago. And then I noticed that there were so many needs that the clients had with lactation wise. So then I broached the subject, why can't we expand the lactation side? So I started there as a doula, then I became the coordinator of the program, then I became the manager of the program. And so we've since expanded the lactation part of the program, and we do a lot of mobile services. So we go into moms' homes. We are a culturally specific program. So we work with moms who look like us, you know? So in terms of that, so we're working with moms that self-identify as Black or African or biracial. And so that's what who we serve. And there's a pressing need. And we know about the maternal child's health statistics that we have in the Black community. And we know that breastfeeding is going to be a very, very important part of looking at health disparities and hopefully in the future to diminish those things with moms breastfeeding for their health and for the babies and benefiting the community. So that's my story.
Okay, wow. Thank you for that. Linda, can you tell us about a challenge that you ran up against along the way?
That program that I told you that had the IBCLCs that were nurses that were there, my immediate supervisor was an IBCLC. And when I asked her, how can I get into becoming an IBCLC? Well, they told me that I didn't have my college degree, so it was impossible for me to become an IBCLC. And at that time, it did not require you to have a college degree. But every time I broached the subject, I I had an immediate supervisor, and then I had a supervisor over her. One was a nurse, and the one immediately over me was a dietitian, and she was Hispanic, she was Cuban. And they both told me the same thing. And it was like frickin' frack, you know, they supported each other in keeping me from being able to discover what the true pathway could be and what I could accomplish. So I actually had to find out for myself, and actually knew then what could be accomplished, but not having the funds to actually accomplish it. So, so that was a hurdle right there to get around. Sure. First, to feel like you being minimized, but my skills were being utilized, but not being able to be looked at as, okay, it is possible, and how can we support her? So it took another 5 years before I got into a situation where I was supported and people were willing to help me to reach that goal.
Well, so thank goodness for that.
Yes, and I always feel responsible to pass it along, to be able to help and look out for my community and make sure that other people can have that options. And as much as they want to learn, we want to be able to help them learn and support them.
And my last question for you is, if you could go back in time and talk to your 2010 self, what would you say?
You should have asked about the traffic pattern. And because I took the test in Maryland, DC at Georgetown University, and I did not know the campus, I would have been better off just taking the train, but I drove in and it was horrible. And you panic and anxiety. And then there was no signage until you got right in front of the correct hall. So I couldn't even find it. I was 5 minutes late, but they wouldn't let me in.
Oh my gosh. Oh my gosh. Well, that's a good message. I think for all of us. Sweet. All right. Save your questions for Linda. We're going to hear more from her later. Let me move next to Marissa McKelvey, who is beaming down to us from, I'm not sure if it's Tacoma or Olympia.
I live in a suburb. Lake.
Great.
Yeah.
So, so your task now is to tell us how you, what your path was to becoming an IBCLC, and what challenges you ran into. What'd you do your first couple of years, and then advice.
It was very. I don't think I ever envisioned myself as being a lactation consultant. I didn't, grow up and say I want to be a lactation consultant. I've been a nurse, a registered nurse, since 2006. And I worked in a level 1 trauma hospital for 10 years. During that time, I worked mostly in critical care. I had my first daughter around 2012. It was my first kid. I had some lactation challenges, but I wasn't even really, I wasn't even that excited about breastfeeding at that point. It wasn't until I was having to pump. I was a charge nurse there, and I could just see that people were really uncomfortable with it. They were uncomfortable with this idea that I would be on the phone and pumping, and sometimes there wasn't a lot of places to pump. And I'd have to cover myself up and be in a meeting, and everyone was just kind of strange about it. And I thought, gosh, you guys, it's 2012, what's the deal? And we also started to get a lot of the patients that would come in that were postpartum, that maybe had a stroke. These patients, they didn't know where to get a pump, how to set it up. I didn't know how to do this either. I'd never seen a symphony pump before. But they were like, Marissa, you're breastfeeding, right? Do you will you take this patient? So I would pump like comatose, ventilated moms and call. I think I ended up finding maybe like the infant risk line. I didn't know anything about this, but I was trying to figure out, could we save this milk? The doctors didn't know anything. They were like, that's breastfeeding. We don't do that. And after like about a year of that, I was like, I'm kind of into this. You know, I'm helping my friends. They're having babies. There's lots of questions. And I could just see that it was so helpful in supporting course. And I get my IBCLC. How hard could it be? Like, it's breastfeeding. So I was looking online and I was like, gosh, it kind of looks like I have to change careers. And so I called a hospital that it's called Evergreen Hospital in Kirkland, and they have a lactation program there, like a lot of lactation education. And I spoke with someone there and she said, yeah, you will have to change careers. I was like, well, what do you mean? She's like, well, you have to have, breastfeeding specific education. And so I knew like I was going to have to work in labor and delivery. I was going to have to work postpartum. I'm like, I don't know if I want to do that. And so I just didn't know how to get in the door. Well, a friend of a friend of a friend said, there's this thing called a lactation counselor. And hospitals in my area in Seattle were using them. And a friend of a friend of a friend said, hey, this hospital does in Tacoma. And she gave my number to the manager of the lactation department there. She called me and she said, there's this program at UC San Diego. You can get the CLC and then you can come and work for us. And I was like, great. So I took this 3-month course. It was online. I got the certificate and I applied for this job. And I started working in this hospital in Tacoma. Mind you, I lived in Seattle. I was pregnant too. And I commuted. And I also worked full-time in my ICU job still. So I was like, but I really wanted to do this. I was so interested in it. And I loved working with moms. I loved working with babies. I loved helping this totally diverse community of nursing position. So to be a registered nurse, I wasn't
Marissa, I'm just going to pop in real quick because your connection drops out every now and then. So sometimes if you turn up the video, even though we love seeing you,
let me turn it off.
Okay.
Stop video. I'm kind of in the boonies. And this always happens too, even from Seattle. But basically, I had to take this huge pay cut in order to get these hours. And so I was thinking like, okay, well, I need these 1,000 hours if I do this pathway 1. I couldn't figure out how I was going to do it. I was like, well, maybe if I work this many shifts per month, I can get this done in 5 years. And so had another kid, moved and left critical care because I was like, I really love working with these babies. I want to keep doing this. Let's find a way. I started in postpartum nursing at the same hospital that I was also doing the lactation counselor position. I did that for about 9 months to try and get more hours because a percentage of those hours would count towards the direct breastfeeding education. Not all of them, but some of them would. I think 25% of those hours would count. I was working nights, I was working weekends, I had an infant, it was bananas. And I was like, I don't know how I'm ever going to get this IBCLC. I don't know if this is going to happen. Well, somebody in the lactation department was like,
we'll get her to repeat
you get it done faster. And so I was like, yeah, that's great. Yeah. I'm sorry, did it drop out again?
Yeah, you were just getting to the good part. You said someone in the department said.
Yeah. I'm so sorry. So someone in the department said, what about pathway 3? Could we make you a mentorship? And so they made this mentorship position for me. It was like they'd never done it before. And the only reason that I could be in this clinic, this is where it's a little bit of a sticky wicket, is because I was a registered nurse. They do not use non-RN IBCLCs in the outpatient clinic. So I worked as an RN in the outpatient clinic with a CLC. Damn. Did my connection freeze?
Yeah. You said I worked as an RN with the CLC.
And I did that for about 9 months.
Oh, got it. Got your hours.
Yeah, and I got my hours. I sat for my exam. I got it in 2018. And I've been in the clinic ever since.
Nice. The same clinic where you got the hours.
I actually just left that clinic and I work at Swedish in Seattle now in an outpatient lactation center there called the Lytle Center.
Nice.
So I was with this hospital in Tacoma for 5 years. Position as an RN IBCLC. Nice.
So any one thing that was your biggest challenge?
Financially, it was a huge sacrifice.
It was moving from critical care to outpatient services.
No, to get my IBCLC, I had to work as a CLC. I did not get paid as a nurse. I got paid 50% less. In my mentorship, they did not pay me as a nurse. I got paid as a CLC, even though I worked as a nurse. So I ended up cashing out a 401k. We went into debt. This was all to get my IBCLC. And to sit for the exam and the education, I had to pay for that all on my own. So none of this is funded.
Yeah.
Really hard. I mean, from start to finish, it took like, a good 3 years.
Okay. I'm glad you're sharing those numbers, because sometimes, we want things to happen fast and they don't necessarily.
Yeah.
So what about your message to your younger self?
That you'll get it. It's just not on your schedule. It's not on your timeline. And you will eventually make some money. But it's not how you think it's going to look, for sure. Not in any way.
Great. Thank you, Marissa.
Yeah.
That's a great message to share. Laura, are you in a place, Lara, or still?
Yeah. Hi, I'm here. Can you hear me?
Yes.
Okay. Hi, everyone. Full disclosure, I'm in an Uber right now, which is why I'm wearing a mask, but hello. Sorry, my flight landed late. This is not happening the way it's all supposed to, but we just do what we do. So, should I get started, Michelle? Just
go for it.
Where it all started?
Yes.
Okay, so back in around 2011, I sort of realized, okay, so this is a job. Lactation is a job. I had babies and did a ton of breastfeeding and knew about it because I used a lactation consultant with my first one in 2003, very briefly. And then I breastfed forever and started, I'm no joke, 10 years, folks, and started just kind of helping friends. And then I was listening to an NPR radio show, a program about how this very high percentage of new parents would like to breastfeed for 6 months. but the initiation was so high and the rate at 6 months was so low. And what is the disparity? And I thought, oh my gosh, I can do this. And so I dipped my toe in. I started volunteering for the Nursing Mothers Council, which is a local organization that does peer-to-peer phone and now text support for breastfeeding folks. And just started taking some classes. I was at this point a stay-at-home mom. I had been in a completely different career, but now I was home with my kids. And so started volunteering with the Nursing Mothers Council, really loved it. It was scary to be giving advice about breastfeeding, but people seem to really appreciate it. So decided, okay, I want to go ahead and become a board certified lactation consultant. At that point, there was, of course, there were the 3 pathways. I decided, I think I'm going to use pathway 1. It seemed like the most realistic, although looking back on it, I kind of can't believe I've made it through. It just seems like a huge mountain at this point. But I did the Nursing Mothers Council, and then I applied for a job at WIC in Multnomah County in the breastfeeding peer counseling program. And to be in that program, so it's a program within a program, and to qualify, you don't have to be an IBCLC, nor are you supposed to be an IBCLC, you're a peer. So you just have had to have breastfed for a year. That was the requirement. And I got the job. I was what was called an on-call employee. So that was kind of like a long-term substitute teacher. So anytime a peer counselor went out on maternity leave or on FMLA or was gone for vacation, I would substitute. And just the way things worked, I ended up working pretty consistently for about 5 years there. I became certified. I took the exam in 2016. And then at that point, I was still at WIC, but someone, a colleague of mine from the Nursing Mothers Council approached me because she had a small private practice where she did home visits, mostly like 95% home visits. And she asked me if I would consider joining her practice. Started it with was moving to a different state and just have someone come as a bow. I jumped at that chance because I knew that my time at WIC was coming to an end. I was certified, and as much as I love working there, you're not supposed to be a lactation consultant as a peer counselor. And so I knew they were going to be sending me on my way pretty soon. And so this was really exciting for me. And as a non-RN IBCLC, I mean, the reality was I felt at the time that my options
Lara?
really kind of limited.
Larry, can you repeat that last sentence? I think it dropped out. About limited.
Oh, sorry. Oh, yeah. I felt like, sorry, can you hear me? Is that okay? Yeah, okay. Thank you. I felt like my options were limited as a non-RN IBCLC. I just felt like I had worked so hard. I'd worked so hard for my hours. I had taken all the classes at, I took a lot of health sciences at PCC, and I took my 90 hours of lactation with PCC at the time. I thought this was a great option for me. So I joined this very young kind of baby private practice. It was just me and the owner of the practice. And I was a contractor for her, which worked out really beautifully because she handled everything: billing, scheduling, insurance, all the things that I hate. And so that was great. She, of course, took a percentage of, and still takes, I'm still working there. She takes a percentage of my visits because we charge by the visit. And it started out really slow. As you probably know, like there are so many incredible lactation consultants in the Portland metro area, lots of great private practices. And it was really hard to kind of break into it, I guess, like just to get to get referrals and to get business. So it started really slow, like 1 visit a week, no visits a week. I mean, like there were weeks where nothing. I was like, is my phone working? What's going on? But slowly we started to get more and more referrals. Midwives would refer, doulas would refer, sometimes doctors. We got in network with a few insurance companies that cover home visits. And so we get referrals that way. And so now we're really busy, busier than, we have more business than we can actually handle. We just brought on another contractor to work with us. So that's great. Things are going awesome. And then in the meantime, I also picked up a part-time job at in the legacy healthcare system and work part-time at Legacy Meridian Park as a lactation consultant. So I'm kind of all over the place, but I don't see, I love the flexibility of private practice. It's really great in that I can set my own hours. I mean, in terms of like, I don't know if this is of interest to anyone, but money, I can make more money in a shorter amount of time, which is nice, but it's a lot less predictable. Like I don't know, from week to week, I have no idea what I'm going to, how much business I'm going to have. Okay, I think that brings us up to present day.
Cool. So Lara, I asked other folks to give their young self some advice.
Okay, so the advice, I have a couple since you're asking. One would be that this is really important work and that there is a really big need for lactation support. I don't care where you are, what city you're in. It's really important. And there are going to be naysayers and people who are like, what? That's a job, and think that like you're crazy, or even, healthcare workers who think it's like a pseudo profession. But it's really, really important. There is a huge void in the birth circle where parents are just like sent into the wild, and they really need help. And so you are filling a very important role. Because I would question myself. I'd be like, is this actually, like, am I doing anything important? And I've come to the realization that yes, it is very important. The other thing is, and I think this echoes Marissa a little bit, is just stay the course, just keep going. There are going to be times when you think like, there is no way this is happening. I was like, so many times I was like, what am I doing? This is so hard, and there's no clear path for me, and I'm not sure where this is all going. And I'm so grateful that I have the support of my family, and I kept going because now I feel like I have my dream job. And then finally, I would say be flexible. The path isn't straight. And, for a while, when I was at WIC, the breastfeeding peer counseling program didn't need me. So I became a nutrition assistant and did certifying at WIC. And I still got to do breastfeeding stuff, but not as much. I became a breastfeeding teacher at OHSU. Just to keep working and kind of stay in it. And all those things I feel like really led me to where I am now. Like, I feel like I got such a really well-rounded education to get here, because I sort of just kept an open mind. I was like, sure, I never thought I would be teaching like big classes. That scares me, but okay, I'll give it a shot. So yeah, be flexible.
Thanks, Laura. That's great. All right, now we have Thea to tell us her story. And I think you kind of heard the gist of the points I want you to hit, right?
Yeah, thanks for having me this evening. So my name is Thea, and I'm a registered nurse. I started working with breastfeeding families before I had kids. And so prior to becoming a nurse, I served in the Peace Corps in Namibia and Southern Africa. And I was doing maternal child health education there. But I honestly, breastfeeding was just happening all around me. It didn't seem like, there was as many issues. It wasn't until I came back to the US and went to visit a friend who had just had a baby, and she was shrouded in this, wrap and, trying to be modest and, figuring it out. And it just struck me how different it is and how we're not exposed to kind of breastfeeding as the norm. Here in the U.S. for many communities, at least. So I became a nurse after serving in the Peace Corps, wanting some kind of tangible skills, but was drawn back into community health nursing after graduation. I first worked in Pendleton, so in a rural Eastern Oregon county, doing home visits with the Nurse Family Partnership home visiting program. It's a national and international, I think it's in 8 other countries, home visiting model where visits are led by a nurse. And you have the unique opportunity to partner with families starting early in pregnancy, before 3rd trimester, and then continuing on through their pregnancy and through their baby's birth and till age 2. So really being able to offer continuity of care and provide prenatal education, understand kind of their goals and hopes, and be able to support them in that. I was in a long distance relationship, and so that led me to come back to Portland, and I continued to do that same role for Multnomah County, where I had the good fortune, and I see one of my former colleagues here tonight, Veronica, hello, of really receiving wonderful mentoring from many of my nurse colleagues, several of whom were IBCLC. And it just seemed like such a natural fit for the role. Here I was doing, carrying my scale and going into these homes and doing these pretty autonomous visits. And I think about kind of my first couple of years, especially in Pendleton, where I just didn't have the same, I had some good education and support, but there wasn't a lot of breastfeeding support in the community. There was just a couple lactation consultants. And I remember being in home visits, where baby was struggling to latch, maybe a partner in the background saying, just make that baby shut up. And feeling so helpless, that of course, that mom turned to a bottle pretty quick because of just the lack of support kind of to get started. And so I was pretty motivated to really expand my ability to work with breastfeeding, just feeding families. It just felt like when you leave the hospital, some families are leaving, before their milk has even kind of fully come in. And when you do that home visit, a couple of days after they're home from the hospital, it's just a time where, I I remember going in, and sometimes, moms would be really engorged and trying to figure out, well, it was working in the hospital and now it's not. And so, I think in the home environment, it's where, right, rubber hits the road, and you're trying to figure it out. And so to be able to meet clients where they're at, I think is something that I really valued in that role, and then to be able to work with them kind of ongoing as well. So it wasn't a strictly lactation role, but it was a significant piece of it, and a piece that I enjoyed. So I ended up leaving the county after about 6 years, and this was after having my first child, and wanted to spend more time at home, as well as pursuing the coursework to become an IBCLC. So I did that with Dixie at PSU for 3 quarters. And during that time, I also started working for the legacy healthcare system, teaching classes. I missed working with families. And so this was, I think Laura mentioned the flexibility of kind of life takes you, different ways, but finding a way to still connect and support families was important to me. And so I've been doing childbirth education, breastfeeding education, and newborn care classes, as well as some of the new parent support groups. So that's been my path. I think the challenge, initially was being in a very autonomous role and just having to kind of figure it out as I was going. And I'm someone who loves to learn and is always asking questions, but I would have to remind myself that because I was doing kind of these ongoing home visits, that if the relationship was there with the family, more often I would have the opportunity to go back. And so just trying to take some of the pressure off myself from needing to feel like I needed to know everything right away, because you're just always learning and growing. And that got much easier when I was in Multnomah County and had more mentoring and access to education and continuing education and reflective supervision, because I think that probably the advice I'd give to my younger self, I think many of us kind of in healthcare have very high standards for ourselves. And I think it would be to just be gentle with myself, and that it's okay to not know everything. It's okay to ask questions. And I think many of us probably are familiar with that quote that people might forget what you say, but they'll remember how they felt with you. And sometimes it's easier to kind of course, you're going to be, caring and supportive and cheerleading, with families that you're working with or friends that you're supporting or whatever the context, but it's easier for some of us, myself included, to be kind of self-critical. And so I think that just a reminder to be gentle is something that I would go back and share with myself.
That's a great quote to end this piece of the program with. Thank you, Thea.
Yeah.
All right, so you've heard 4 different stories, and there's a few other IBCLCs in the room. So this is your time to ask questions. You can raise your hand or put it in the chat. You can call out somebody by name or just address to the whole group.
I have a question.
Yes.
I'm not a nurse, but I do want to become an consultant, lactation consultant. What path should I go?
Mm. Are you in a job right now, Lupita, where you have contact with breastfeeding families?
No.
No. So it would probably, you would have the pathway 2 or 3.
2 or 3.
Right, right. And then, like we had mentioned earlier, the doing those sciences class is going to be the thing to do right now to get prepared. And it sounds like you're already on that path.
Yes, it's gonna take a while, but my goal is to finish. Thank you.
Yeah, thanks.
And the prerequisites for the lactation program are very similar to the prerequisites for nursing school. So some people are, pursuing, both, or yeah.
Every now and then, that's the advice I think about telling myself, that, oh, when I was 35, I thought I was too old to go back to school to become a nurse. And, oh, that wouldn't have taken forever. But so that's a nice reminder.
You guys talk about not the where you go out and you find like the mentorship, but the practicum that you guys offer through the OHSU PSU program. Where are those hours typically done? Are those typically done like at OHSU, like in the hospital setting?
I'm going to let Rachel do this because she leads up that part of our program.
So actually, before you get to me, you actually first start working with Michelle, who helps if you're not in the Portland metro area. If you're living outside the Portland metro area, we try to help, encourage not only the student, but we can kind of help identify healthcare facility or similar site in your area that we would then, we would still be, you'd be working with a preceptor locally, but they'd be still, part of the program here in Portland. So, once we have a facility identified, it can be anything from a hospital setting, whether it's inpatient or outpatient clinic, sometimes they're combined. We have partnerships with pediatric practices. We have partnerships with other, kind of community breastfeeding support organizations. And because Portland, we're so fortunate enough to have the milk bank here in the Portland metro area, even if time is not spent the full precepting at the milk bank, we haven't done, but you are able to spend some hours and accumulate some hours at the milk bank. They've been really great in accepting students and helping students, have that exposure. Some of our students, in the hospital settings, depending on the type of hospital, can even acquire NICU experience, firsthand NICU experience as well. So we kind of work with you, as we're moving towards practicum, we're working with you to help identify those kinds of facilities, whether it's here in the Portland metro area or wherever you live, and help, navigate that partnership. And then we work directly with your preceptors, wherever you are. Yeah.
And then what is the typical time frame? Because it's 300 hours, is that correct? If you're doing that for
great. And so the practicum classes themselves, we meet as a class remotely once a week. But we do expect that the practicum student can be available for at least 2 8-hour shifts a week at their clinical site. Most practicum students can get, that since it's broken up into 3 terms, we have 2 longer terms and then a shorter term where you're actually at your site. I'll just give you an example. This particular cohort, most of them were just shy of 300 hours by the time we started the 3rd quarter. So we also like to talk about the difference between acquiring your hours for the program, but then also being part of the practicum course. And so even if somebody reaches 300 hours, we still encourage to continue to get that experience as long as we have that opportunity throughout the remainder of the course. The other thing that we added, I meant to mention this too, is that before you even start your practicum, there's a short class that we have in the summer, just before the fall term starts, where for those who haven't been in a clinical setting before, it kind of helps provide some information, to some insight into some of the things that they'll experience there, and kind of prepare them so they can kind of hit the ground running when they get there, versus having to just for the first time perhaps be exposed to some of those things. Yeah. So generally you're looking at is, you know, starting late in the summer and finishing, let's see, our class here is finishing up mid-May. We like to finish the class in time for students to be able to actually apply for the application deadline. So we make sure that we were finished up with class before that deadline.
Thanks. Okay, we have two interesting questions. One is about being a dentist and how to incorporate that into their dental practice. And then the other one is about being a non-RN and how does that change your job prospects. Who of all our panel or faculty want to take that on?
I would like to take that one.
Go for it.
I've seen so many instances now when we're talking about so many different issues with latch on. So when you look at it as a dentist, you have dentists that are actually doing some of the things that you may have an ENT doctor doing with the revisions to children who have tongue tie and other abnormalities that require looking at the muscles in the face and the mouth, tongue, etc. All those things that are incorporated into lactation. So it is pretty similar. So you may find opportunities incorporating that into your lactation, you know, the lactation practice into your dentistry. So, I mean, they can go hand in hand. So there are a lot of opportunities because you have, instead of going to ENT, some doctors go to dentists that have that surgical experience, or if you were an IBCLC, you would have both, and you could incorporate that into some type of practice where you could be helping people with latch on and things like that. If the baby has some kind of abnormalities with physically, you know, that prevents him from latching on.
Right. I mean, I could fantasize about a clinic where somebody shows up and shows the dental / IBCLC, well, this is what the baby does. And they say, oh, I wonder if my other hat could help fix this. And then you can help after as well. All right, what about the question for if non-RNs, is it gonna hold us back?
For me, I found that when I looked around the country before I moved out here, and just looking in certain places, in California, you have some opportunities where they don't require you to be an RN. But in a lot of other places, they do want an RN because the hospital feels they can capitalize on you as a nurse, plus, as you as an IBCLC. So they can utilize you in both functions. So why not? But those of us who have not gone into nursing or not RNs find that, you know, it's very difficult in some hospital systems to get in and to get employed.
Right. That is, yes. And we want to be realistic when we're talking about it, you know, like it would be nice if we could wave a wand and all hospitals would hire lactation consultants, no matter their background, as long as they have the certificate, but that's not going to happen, I don't think. Anybody else want to talk about that? Yeah, go for it, Dixie.
Yeah, so, and that said, we also have to remember that, let's see, on our lactation faculty right now, there are 4 of us, and none of us are nurses, although I have great respect for nurses and have worked with many wonderful RN IBCLCs. And all of us have worked in hospitals. So I think the key is to remember that not all hospitals are going to hire non-RN IBCLCs, and hospitals are not the only place where IBCLCs work. So those are important things to keep in mind, because we kind of get focused in on, you know, people say this to me all the time in advising sessions. Oh, I looked online and all the jobs say you have to be an RN. And I say, I understand that. And you probably are going to find there's probably a lot of other ways to find a job, because there are jobs out there for non-RN IBCLCs. And I have never gotten a job online. I have always gotten a job through the people that I have met in the wonderful lactation community saying to me, oh, there's a job opening here. I would really encourage you to apply for it. So that's one of the things we really encourage people to do, is get involved in the lactation community so people know you. And through our practicum, people get great experience shoulder to shoulder, showing the kind of workers they are, the kind of lactation professionals they are becoming. And so that's a great job reference too.
So Asia, I saw that you mentioned getting your dream job. Do you mind sharing that?
Yes, so my mentor is Miss Linda Bryant Daka, and I am now a part of the Sacred Roots and mobile lactation program as the lead breastfeeding specialist.
Nice.
And it just happened to fall into my lap. It was by the grace of the Creator. And so keep looking. You don't have to be an IBCLC, although I am going to be an IBCLC. I did Dixie's program, graduated Portland State last year with my bachelor's in science. And so you can do it. I was one of those ones, I think it was either Dixie or you, who are like, well, just get your degree. And I was like, oh, okay. So yeah, I mean, it's serving my community. It's the reason why I wanted to be an IBCLC in the first place, is to stand in that hole where we weren't seeing many providers that look like us, to make us feel welcome. There's something about a lived experience that we can really tap into and increase those numbers of initiation.
Thank you. I'm glad you all found each other.
And I think also, when you were talking about every opportunity is in the hospital, I mean, I've always believed in being creative. When I felt there was a need in whatever community it was, to figure out how you can satisfy that need. And you're creating a position for yourself and others in fulfilling those needs. So whatever communities that you see are lacking these services, you know, and fit yourself into that. And especially if you are part of that community, because there are a lot of community-based programs, or you can start out on the educational side that, you know, you can start out as, you know, looking at child, you know, other maternal child health, you know, titles, and then fit yourself in from there. And the program could be expanded more into the lactation side. So it's a lot of different ways, but I think you always have to think creatively, especially when you don't meet the certain way that people tend to think in lactation that you should, to be able to fulfill, you know, these requirements. And so just think creatively. And I think, in like Dixie was saying, networking, that's a very important part of it. But if you don't know what a network is, you first have to get your foot into that. But working within maternal child health can be it. But everybody does not want to be a nurse. It's a beautiful profession. I started out, and that was another thing I didn't say, that I actually started out, and I went to nursing school to start, but I didn't feel that was for me, you know. So, but I actually had some of the prerequisites that I was not told that I needed when they said you had to have a degree. So I actually had, you know, most of the prereqs would have been done. So just being creative and knowledgeable and researching things for yourself, and just trying to see where you can make an opportunity for yourself. And I also did the whole, you know, having my own practice, you know, Mother's Essence International, I call it my business. So I've done that too. So just find where there's a need and fulfill that niche and create an opportunity for yourself if necessary.
Thanks, Linda. Maybe Marissa, could you answer the difference about what's the difference between an IBCLC and a CLC?
this here. Do you want me to turn off my video?
Yeah, I guess.
I can't. Okay. So the CLC is I mean, I think there's sometimes you hear like an LC or a CLC. So it's a certified lactation counselor, and usually it's a program that's for a couple months. It's not a license. And you get the certificate at the end. And most, the hospital that I was working at is a community-based hospital, about 45 minutes outside of Seattle. None of the hospitals in the Seattle area use CLCs. They do not get paid the same as an IBCLC does. So the IBCLC is the International Board Certified Lactation Consultant. You're going to sit for the exam. You're going to follow one of these 3 pathways. You have pretty extensive lactation. They're really different. The CLC definitely got me in the door, but I wouldn't have been able to do any of this without getting that CLC. And so it was kind of my gateway in, and it was affordable. I think it was like maybe, I mean, it's a big chunk of change, but it was, I think it was a 5-credit class. Whereas the IBCLC, I ended up having to do, I think, is it 90 hours of education? Right.
And I think typically the CLC is about 45, 50 hours.
Yeah, it was 45 hours.
There you go. Yeah. And I have been, you know, since taking on this job and talking to different people in the area in California, the CLC is used a little more. I was surprised to find out, like at Kaiser and some of the systems down in California, they have a role for that position. So that's just another little thing if you're in this period of inquiry while you're sort of looking into things. It doesn't seem to be as prevalent here in Oregon, but who knows where we're going next as we see some changes as far as more paraprofessionals sometimes helping as doulas are coming into the hospital more and getting paid by the hospital. It will be interesting to see if that changes as well. All right, there was another interesting question. Emily wants to know, what's the exam like and what happens if you don't pass? Lara, you haven't answered anything in a while. Are you still around?
Hi, yeah, I'm still here.
Oh, good.
I'm at home now.
Oh, good.
The exam, I mean, it's like a very basic level of exam. Like it's like a base level of breastfeeding knowledge, but it covers a broad range of topics. There's statistics, there's going to be like case studies, you're going to be asked to look at a picture and have to recognize what's wrong in this picture. It's not, I mean, if you know it's a study, which is a big part of it, and you are well prepared for it, it's not an incredibly, super, I felt like it's like a very basic exam. I mean, it's very important, but it's stressful. I felt like it was very, very stressful because, first of all, like you have one shot there. I think it's given twice a year, Michelle, now. It's a big deal to register for it. You need to show that you have your hours, how you got the hours. There's a chance you could be audited for your hours. So you have to make sure your hours are well accounted for and they're real. And then you go to thanks, Dixie's putting in the chat what's in the exam. She knows a heck of a lot better than I do, for sure. And then you have to go to like a testing site, and it's like super stressful. And then if you don't, I mean, if you don't pass it, you basically, I believe, wait until the next exam, which is usually 6 months away. And then, this is not part of the question, but you have to wait like months and months to get the results from your exam, which is also incredibly stressful. Yeah, so that's sort of the that's the exam. There's a I mean, I took Dixie's 90 hours before it was part of the PSU program, and that prepared me really well. And then in addition to that, I took some, there's lots of online programs you can take with like sample tests and quizzes and ways to prepare for it. So there's no shortage of ways to prepare and resources to help you to prepare for the exam.
I just wanted to mention, I'm Ashley and I'm an IBCLC down here in Rose as well. Just for if you're studying for it, just remember that everybody in the world is taking this test. So remember, hand expression is important because not everybody has power or a pump. So I thought that that was really important and a key that I took away for studying for this.
Yeah, it's international. So they're not going to ask you questions specific to the US. They're going to ask you questions that apply to breastfeeding and lactation. And we also help our students prepare for the exam by helping them, whether it's the scheduling live sessions that are via Zoom where everybody can practice some exam questions, or sharing, models of exam questions and, doing that just digitally and then talking about the answers. So we really do help our students prep for the exam.
And I can just add that the course through PSU was really helpful in terms of feeling well prepared. It's still a big exam, but you're well prepared. There's the practice, quizzes each time, and there's the live study sessions. And then I believe that the who is it that does the IBCLC exam does an official practice test. And so by the time I took it, it was, you've prepared for it. And so if you can stay calm, I think that there's a very high passage rate from the PSU program.
Mm-hmm. I'm going to launch another poll while people are thinking of their next question.
And while you're doing that, Michelle, I just wanted to add, Carrie put a great response in the chat about the difference between a CLC and an IBCLC. And thank you, Marissa, for your experience. The other thing to know too about the difference is that in many states now, whether you're an RN or not, if you're working as an IBCLC through the state's health department, you potentially will need to be licensed too. So like here in the state of Oregon, you need to obtain licensure to be able to practice. So that's another difference as well.
And one of the questions we got was about scholarships. And I think there's posted in the chat about a PSU specific scholarship. And I just also wanted, for those of you who are thinking, it wouldn't be now, but when you do take the test, our local Oregon Washington Lactation Association also has a scholarship to help people with the funds for taking the test, because that is not insignificant. So that's another resource out there.
And I actually got the scholarship last year I had to recertify, and they gifted me. So yes, I was last year of that. So yes, I can speak to it's just really, you can get a scholarship also through ILCA. They have scholarships. It's not very many, and it's very competitive, but they do have a scholarship. But just getting started, taking lactation specific education is really helpful, and it'll help you really determine if this is what you want to do,
Great. All right, so it looks like our poll results are in for those of you who were able to participate, that about 2/3 are thinking of the hybrid class, which would begins in the fall. And then another third are thinking about the 100% remote class, which those are recorded and you're able to do them. You know, you can do it at 2 a.m, you can do it Sunday mornings. It's on your own schedule. So that's another option for you. And then as far as the pathways, we have a few people who pathway 1's going to work for, and then quite a few that are thinking pathway 2 will be the way. And then one person who's thinking about pathway 3. So thank you for that. All right, I didn't see what the new message is. Does anyone have anything to add?
I think someone had asked about global opportunities outside of the US, and it is an international certification. And recently a friend and colleague moved to Germany, and after about a year of learning the language, started working in a private hospital there. She's a RN, but knew that it would be harder to transfer her RN license. And so she, that was her ticket in, was being certified as a lactation consultant. So it is possible.
Great. Dixie, do you know the answer to the question about scholarships for non-US residents?
Well, I think the question was, do you have to be a US resident to apply for the scholarship? And no, you don't. You just have to be eligible to become a PSU student, right? Because the scholarships are for PSU students. They're not to be used in other lactation training programs. And then someone else asked about, can you use the GI Bill? Yes, you can. We've certainly had veterans use the GI Bill to pay for their lactation coursework. Yeah, and we have a veterans center that can help you with that. So you're very welcome to use the GI Bill.
The ILCA scholarship can be used by anyone globally. So that ILCA scholarship that I was speaking about can be used. I sent the message back to her, but yeah.
Yeah, and there's also exam scholarships through, and also lactation training scholarships through USLCA. So USLCA is the US Lactation Consultant Association, which is the US affiliate of the, Linda's talking about the International Lactation Consultant Association, ILCA. So there are many different organizations right now that are providing support to help folks get lactation training and complete their exam. And so we can help you look for those resources. Yeah.
All right, before we end here, I wanted to, let's see. Well, okay, best laid plans. How about that? Got questions? That is our address. If you can think of anything specific or even not specific. And I do want to put a plug in that next Monday evening, we are having an open house about the program in much more detail. So tonight was about getting you excited about lactation. Next week is more the nuts and bolts of how to apply, and we'll share faculty and student experience and that kind of thing. Anyway, so all of you who came, I will pop you an email that has the invitation to that, and you can register. Would anyone else like to say any words of closing? Well, we're so glad that you all joined us tonight. Oh, somebody started saying something.
I just wanted to say that I love lactation. It is like the best, it's the best job. And even though it was so hard to kind of make this transition, and it looked so much different than I thought it was going to be. I mean, people who work in lactation love their jobs. We love what we do. So I couldn't ask for a better job.
There's no bigger satisfaction than when you have that duo of mom and baby.
Oh yeah.
And when mom is successful, oh my goodness, the energy is so beautiful when you see a mom, when a baby is latching well and mom is comfortable and he's gaining weight. It's just a wonderful feeling.
It is the best feeling. Yeah.
And I have to say, just like the lactation consultants love their job, I have not met many lactation people who are not cool to hang out with. They are very, very personable people. I don't know, something about it. All that oxytocin going on.
And I think there are jobs in healthcare right now. I've had different job searches, and recently clicked the button on LinkedIn to say that I was looking, as I'm planning to transition back into clinical practice, and was contacted by 4 nurse managers within 2 weeks, specifically about lactation jobs in the Portland area. And yeah, and I told my husband, I was like, where is it coming from? But then I remembered that, we have these, there's all these online job search tools that you'll use when you're in your job search. So just best wishes to everyone as they make this next step.
Yeah, and if on our little email that we send out, on our email blast that we do twice a month, we try to include any job opportunities that we're aware of. So we'll post those and take a look at those when you see. And so, yeah, we would love to see your reactions. So you can either, you can go down to reactions down here at the bottom. How are you feeling now that you've heard from this wonderful panel of lactation consultants? Go down and click on your reactions button and pick a symbol for us to give us your reaction now that you've heard from these great folks. And yeah, I just want to say thank you to all of you for being here, and thank you to our panel for giving us such a wonderful broad perspective and a hopeful perspective of, persevering and becoming a lactation consultant. Each one of us who has done that has been forever grateful that we have the job we love.
Yes.
Yes, so I'll give another thank you to Linda and Thea and Lara and Kelsey or Marissa for showing up tonight and sharing your beautiful stories and inspiring the next generation. All right, with that, we'll say good night, everyone. Thank you.
Good night.